And with more on the global fight against HIV/AIDS, we're joined in Los Angeles by Michael Weinstein. He's the president of the AIDS Healthcare Foundation, a global organization dedicated to providing cutting-edge medicine and advocacy in combating HIV/AIDS. Thank you so much for joining us.
Thank you for having me.
You know, Michael, the rates of AIDS, HIV are on the decline worldwide. Do you have a time frame in your mind when you would like to see AIDS wiped out completely?
Well, the only way we're going to wipe out AIDS is if we have a cure. And AIDS Healthcare Foundation is involved in research for a cure, and we remain hopeful of that. But in the meantime, what we can do is control AIDS and control HIV. And the way to do that is to get as many people on treatment as possible. So our organization, which cares for more than 360,000 people in 36 countries, our primary goal is to get to 20 million people on treatment worldwide by 2020, or 20 by 20. And AIDS Healthcare Foundation itself is committed to reaching 1 million by that time. And that, in conjunction with getting people tested so that they know their status and doing primary prevention by promoting safer sex, that's the way we can control it. And there are countries in the world that have already done that.
Well, which nations do you think have been the most successful when fighting AIDS, and which ones do you think need more improvement in that area?
Well, in the Asia region, Cambodia has done a remarkable job. They've decreased their prevalence of HIV by 2/3. They have a system where almost everyone is being cared for, and they have wide-scale testing. So that's a really big success story in Asia. Thailand has had some good success as well. In Africa, you have countries like Botswana, Senegal, and some others. In South Africa, which was having a lot of difficulty in years past, they've really scaled up tremendously their testing and treatment. And they're on the road, I think, to having much better results. But what happens once you scale up treatment is that people become complacent, and therefore you start to see the rates of infection rise. And that's what's going on in South Africa. But the United States, even though we are the largest donor to global AIDS, we're not doing that well in this country. I mean, we still have a steady state of about 50,000 people being newly infected every year. But most of all, I have to remind people that the war against AIDS is not over, that we have more than 1.5 million deaths in 2014 and 2.1 million new infections. Even though we're very, very concerned about Ebola, the numbers of AIDS deaths and AIDS infections vastly outnumbers the threat from Ebola at this point in time.
So what do you think is the biggest challenge ahead in this fight? Are you more optimistic or more concerned when you look at the global picture? Do you think things have improved, or could they be much better, or should they be much better than they are now?
Well, I think we're a victim of our own success, both in terms of the fact that people are less scared of HIV because it's treatable, but also I think that the donors have become complacent, and they're giving less money. I mean, there are many of the BRIC countries that are not donating at all, and also the funding for global AIDS has been either flat or in some cases even declining. So, I mean, if we're going to finish the job, if we're going to win the war against AIDS, then we have to stick with it. And that means that we have to continue to fund it. And also, we have to also be concerned about issues having to do with intellectual property. We are seeing more and more countries being classified as middle-income countries. And when that happens, they lose access to generic drugs. And that's really challenging a lot of countries which do not have great resources to cover the needs for their own countries. But I mean, if you look back in 2000, when I attended the International AIDS Conference in Durban, South Africa, there were only 50,000 people being treated in Africa for HIV, and now there are many millions. So we've come a very, very long way, and I think if we stick with it, we're going to be very proud of what we've done. And if we don't, then we're going to look back at this moment in history, and really it's going to be a shame.
All right, Michael Weinstein in Los Angeles, thank you so much for joining us on World AIDS Day.